typically see is that those superficial muscles, those erector spinae, those big muscles that are along either side of the spine become really tight or even spasmed. And so one of the options that we have in terms of loosening them is actually instrument-assisted soft tissue mobilization. So rather than using my hands or kind of trying to dig my thumbs in, which can definitely be uncomfortable both to the patient as well as to my own hands, particularly if you're doing it a lot, I can use an instrument or a tool. So these are actually HawkGrips, a metal tool to help assist. What I actually find is beyond just comfort for the patient and comfort for me as the clinician, I'm really able to feel the quality of the tissue with the instrument as opposed to my hands, and really kind of get feedback from the vibration of the tissues and how well the instrument slides on the tissues, get a little bit deeper with the instrument than I am able to with my hands. So we're going to use a little bit of emollient on her back. We'll just spread that. Again, it just helps with the instrument kind of slide. There's different shapes of tools, kind of depending on the area and the size of the area that you're trying to use. With these, we actually have a beveled edge on the HawkGrip, and we're going to use that to get a little bit deeper. There are times that we might want to use the flatter edge, but for the most part we want to use the beveled edge because we're able to access and get the tissues a little deeper with that as opposed to the flat edge. So from here I'm just going to use my hands and I'm just going to start kind of pressing. And I'm actually, while I'm doing some treatment, I'm actually assessing the soft tissue at this point. So I'm seeing where is it giving feedback, where is it sliding smoothly over the tissue, and where is it becoming a little shakier, where maybe the tissue isn't of great quality, we have some knots, we have some trigger points in there. And I can move just kind of laterally. I can press deeper through the tissue if I want. And right now I'm just doing long strokes kind of to the tissue, trying to loosen this up. What we're going to start to see is actually a little bit, kind of slightly with her, a little bit of redness of that tissue, where we're getting some blood flow to the area, which is great for healing properties. And again, we can work on either side of the spine there. We can go with the direction of the muscle tissue, which we're doing now as we're going vertically. But if we want to do a little bit of cross friction for whatever reason, we could do kind of the strokes horizontally, or we can even take the edge and do a little bit with that as well. And there's some different tools that we can use to get that. But particularly with the lower back, we just like those nice long strokes, trying to loosen up that tissue and reduce the spasm through the lower back.